This is Spotlight Omaha. Spotlight Omaha is a local podcast that highlights local businesses and influential movers and shakers in the Omaha business community. Spotlight Omaha is brought to you by Pixel Fire Marketing. Now, from the Pyramid Contractor Studios, the host of Spotlight Omaha, Jimmy Allen.
Good morning, everybody. Welcome inside the Spotlight Omaha podcast, where we take you around the city of Omaha, introduce you to local business owners, influential figures, and people who are making an impact on our community. We are brought to you by Pixel Fire Marketing. Pixel Fire Marketing is a locally owned marketing firm that specializes in website design, creating social media ads, and engaging your business online. If your company could benefit from any of that, check out pixelfiremarketing.com for more details today. Joining us inside the Pyramid Contractor Studio is Derek Scholl, Young Chiropractic and Rehabilitation Center. Thanks for being here, Derek. Appreciate it.
Thanks for having me, Jimmy.
Two different locations for Young Chiropractic. Why was it such a big deal for you guys to be able to do business in Papillion and Northwest Omaha?
So, I guess the biggest thing is being able to have an impact, with patients across the city.
Sure.
With the eventual goal to grow even and expand even further, right? So,
because that's kind of what the city's doing by itself, right?
Exactly. Yeah. So, the La Vista Clinic had patients, the north side of the city, northwest side of the city, that were driving there every day to get treated. And now this just makes it more convenient to them. And it also opens up our services and the stuff we specialize in to that area of the city as well to attract new patients.
Let's talk about that, because it's a competitive market. There's a ton of chiropractors and people running rehabilitation centers in the Omaha area. What sets Young Chiropractic apart, in your opinion?
We get this a lot, that it really comes across how much we genuinely care about our patients, right?
Sure.
And our staff as well. In order to get that mindset, you really have to get a staff going that believes in that too.
Can't just be you, right?
Yeah. And you learn that fairly quickly, right? So I used to own a business in Lincoln that I sold to come on full time here. And that's the first thing you learn as a business owner. Is like you generally have to care and be invested in the patient's healing and getting them better.
What was the biggest difference between doing business in Lincoln and doing business? Well, you run it's Northwest but Bennington area clinic. What's the biggest difference for you, just from a doing business standpoint?
It's pretty similar, really.
Yeah, I figured it would be. Okay.
So I had the Lincoln Clinic, had one in a small town northeast Nebraska called Elgin. I'd go up there once or twice a month. That's a vastly different selection of patients compared to down here. But between Lincoln and Omaha, it's fairly similar.
When we talk about actually treating a patient, it's probably a little bit different than I picked my 2-year-old up and tweaked something versus treating somebody that's dealing with spinal depression or scoliosis. How do you guys handle and manage those two different types of patients?
So a common misconception that I've experienced is that people think that chiropractors are just for the spine. Right?
Yeah. We'll crack your back and see you in a week. Yeah.
We're total joint and orthopedic specialists, right?
Why is that a big deal for you guys?
Because, we can treat more conditions than just spine-related stuff, right? Okay. We can treat anything non-surgical that relates to shoulders, elbows, knees, hips, ankles, all that stuff, right? So, we are a conservative, non-surgical approach to rehabbing those areas, and a lot of people don't realize that. So
yeah, and kind of helps avoid the medicine portion of things as well. Not only do you guys focus on the joints and the issues that are ailing, you guys teach stretching techniques and help people strengthen their core and body parts just to try to prevent the surgeries that you just mentioned. Why is that part such a big deal?
Because once you get that patient feeling better and pain-free, it's really important to rehab the patient and retrain their body to kind of keep it in that position in order to remain in that state. Anybody can have a patient they see once every 3 weeks, but our ultimate goal is to get that patient feeling better, staying better, and then they just come back for maintenance because they want to prevent.
Right, be preventative instead of reactive. Yeah. Obviously, the process at the beginning can be a little drawn out. You guys do x-rays and things like that. Yeah. Can you walk us through what the first visit to Young Chiropractic looks like, and then we'll talk kind of after what it looks like after that?
So typically, you would come in, if you don't have the paperwork already filled out, our staff would give you the paperwork. Then we'd take you on a tour after the paperwork's filled out. We would sit you down, do a full comprehensive examination, including orthopedic tests, neurological tests, muscle testing, all that stuff, so we can properly diagnose the issue that's going on. You can waste a lot of time in the chiropractic and rehab fields not
Sure.
properly diagnosing the issue that's going on, because if you don't properly diagnose,
You got to find out what's wrong before you can fix
then
it.
you're not going to treat
Right.
it the right way, right?
How much of and it's probably different at Bennington versus Papillion, but how much for you personally is your clientele percentage wise a chiropractic patient versus a rehab patient, and kind of where do you guys kind of divide your time at?
So, some patients we take on, they're just looking for new maintenance chiropractor, all that stuff.
Mhm.
We assess them. If I deem that they're not necessarily ready for maintenance yet,
Yeah,
like they might have been,
something serious is
yeah.
probably going on. Yeah.
then we try to get them to the point where we get them feeling better, rehab, and taper them to maintenance, right?
Sure.
Obviously, if you're coming in with an acute condition or a chronic condition even, it's going to take a little bit of time and work to get you to where you're feeling better, pain-free, and staying that way.
What is the most, because you've got, and I know a few people. I've been getting chiropractic care for the better part of 5 years now, and I think it's completely changed my life. But you've got the naysayers out there. It's witch doctory. It doesn't really work, et cetera, et cetera, et cetera. And I in complete testimonial, I swear by chiropractic care. I think it's completely changed my life. What is the most common misconception you get from people that are coming in to see a chiropractor or go to do rehabilitation for the first time?
Again, I think it goes along with not quite understanding or knowing that we can treat most musculoskeletal issues, not just
Sure.
spine-related stuff.
Right. If somebody does have doubts about getting chiropractic care, what's the piece of advice you give to that person when they're coming in the first time?
I mean, it's a science.
Sure.
You don't have to believe in
There's
it.
a doctor by my name for a reason, right?
You don't have to believe in it for it to work, right?
That's good. That's a good point. That's a good point. Obviously, when people come in for the first time, you guys do go through the X-ray process and all that. How much are people? I mean, that machine's a little intimidating when you walk up to it the first time. Are people often weary about doing? Obviously, I'm sure you guys treat pregnant females and things like that. How much does that process kind of make people a little leery at all, if at all?
We can't X-ray pregnant women,
Right.
But for the most part, X-rays are pretty commonplace to where
Sure.
it's not what it used to be when I first started.
You had to hide behind the brick wall.
Yeah. It's not like an MRI where people that get claustrophobic
Sure.
are going to have a lot of issues with it. For the most part, X-rays are pretty cut and dry.
What is the biggest hurdle in your opinion facing the chiropractic industry?
Just still dispelling a lot of those myths.
Sure.
We still battle some of the medical elements where primary care providers don't necessarily.
Like from an insurance standpoint type thing? Or?
Yeah, insurance as well. But I think insurance is difficult for most providers these days.
That's because the insurance people don't know what they're doing either.
I'm not on record saying that.
Sure. When we talk about doing business as your own practice versus selling that off, becoming a partner here, and Dr. Young's first name is Peter Young. What is the biggest difference from your standpoint as a partner in this business versus sole propriety previously?
I mean, obviously, I have a vested stake in it, right? So, and
keep in mind he's probably watching this. So.
Yeah. I have a vested stake in it. Obviously, I'm motivated. I'm not just like some associate come along. I have that 8 years of owning a business experience.
Yeah,
with me. So I know the ins and outs of what it takes every day from a day-to-day process. One thing that I sold my business to not commute anymore.
Sure.
Because I was commuting for 8 years or 7 years, basically. It has really allowed me to focus more on the stuff I'm passionate about, which is being a good clinician and getting great results, and the stuff that I went to school for
Sure.
a reason, right? And step aside from the business aspect where we have other people now that can handle that.
We're catching up with Dr. Derek Scholl of Young Chiropractic here on the Spotlight Omaha podcast, brought to you by Pixel Fire Marketing and Pyramid Contractors. When we talk about the onboarding process for a new patient, how long does that usually take to get, and how often are they coming back to obviously it's probably different for everybody, but kind of broad strokes, how often are you asking patients to come back?
So typically, anytime you're looking at some form of rehab, right, it's going to be just like physical therapy. It's going to be a little more frequent starting out, right? Because you have to get on top of that pain, right? You have the small amount of time they're there every week is minute compared to stuff they're doing to aggravate those things, right?
Or prevent the aggravation.
Exactly. Yeah. So typically, new patient comes in, we're doing a comprehensive exam and x-rays just to rule out stuff we would have to refer them out for the most part. And most importantly, to then educate them about their spine, right? So underlying stuff that's there that may be causing them to feel bad or, down the road may cause a hurdle in them progressing.
Is it fair to say, with these things being as popular as they are, the most common visit that you get is somebody that's probably staring at their phone, staring at their computer every day? And what advice would you give to that patient?
That's a big part of it. That's called tech neck, right?
Oh, okay. I didn't know that was a term.
Tech
it makes
neck,
sense that there would be.
Staring down at phones, tablets, looking at computer screens.
Sure.
Most people have terrible posture.
Yeah.
And that goes.
It's me. I'm most people.
that goes into neck pain, mid-back pain, tension, headaches, all that stuff.
Gotcha. And what piece of advice do you give to that person? Stop.
Yeah. There's not, this day and age, there's really just, it's just part of life, right? So that's where chiropractic can come in. We can get those joints moving properly and then rehab your body to improve your posture and take away a lot of that tension.
We spent a lot of time in this room talking about community and sense of community. We mentioned you guys are just outside of Bennington, just a little bit south of where the tornado came through this spring. What has the reaction from the community been like for your practice and you guys being in the area? You guys are in a great strip mall, great location out there. And what was the response from you guys to the community when a tragedy like that happens?
The community has been very receptive of us there. They were very happy to see us open up when we finally got the doors open. I still remember that day. Me and Holly, my office manager, we stepped right outside and saw it barreling towards us, and then thankfully it veered off. Not so thankfully for other people, it veered off. But
sure,
you hope that you never experience anything like that.
Right. If when it's got to, not to harp on negative, but obviously when you're going through that experience, it's probably got to be surreal. Holly's a friend of mine, one of my oldest friends. We talked about that day she was at the practice when it was happening. What's the thing that's going through your mind when you know something like that is so close to your business, and what is the first reaction to it?
Hope and pray.
Sure. I assume that's what it was.
I've never really been that close to anything. As far as what we did to help, volunteered our time to help clean up certain areas. Obviously, they shut that down at some point because they had
too many people. I was out there with my truck and they stopped letting me come in after my second load. So.
Yeah, and we offered free spinal care to people that had been
very cool, very cool. If somebody is thinking about making a switch, or maybe they're moving to the Bennington area and they're farther away from their chiropractor, why should they check out Young Chiropractic? What can they expect when they walk through the door?
You can expect smiling faces.
Sure.
Great care. Yeah. Our goal, we are invested in you and getting you better and back to your normal way of life. Pain can cause you to be miserable.
Sure.
Up until I had a hip issue that required surgery. It was just a structural issue that nothing was going to fix.
Right.
I was miserable for 3 years, and I no longer am. And it completely brightens your day not to be in pain, and that's what we can offer. Both locations, we have plenty of experienced docs that have treated thousands of patients and rehabbed thousands of patients to getting better.
I want to ask about that, the other doctors portion of it, because a lot of the conversations we have in this room is about hiring, and we just talked to a local coffee company, but obviously hiring a 16-year-old barista is a little bit different than hiring a doctor that's been practicing for 8 years. How difficult is it for you and Dr. Young to take a step back, kind of delegate to other, obviously this is a doctor, this is somebody that's a professional, but is it difficult for you as a business owner to kind of take your hand off the wheel and allow somebody else to kind of come in and put their fingerprints on kind of what you guys have already laid the groundwork for and created?
Yeah, it takes a lot of faith.
Sure.
But that's where the interview process comes in. That's where the screening process comes in. You gotta hire and seek out like-minded individuals that are going to be working towards a common goal, because you can waste a lot of time and energy bringing in people that, down the road you start butting heads with.
Right.
And if
got to stay in a room with them for 8 hours a day.
Yes. And you have to have staff that are invested in the patients getting better as well, and want to see those people get better and not just go through the motions.
I have to ask you mentioned the hip injury. You walked in wearing a Team USA wrestling jacket. Are you a former athlete as well?
Yeah, not a wrestler.
Okay.
But,
sure.
So I played football in college at Midland, just a little small school.
Yeah.
My Lincoln Clinic, I worked with the University of Nebraska wrestling team the last few years.
Okay.
And then I'm the personal chiropractor for Jordan Burroughs.
Oh, all right. Well, that came full circle.
People
All right.
might know who that is.
Yeah. Just seen him at the state wrestling or the wrestling tournament this weekend.
Yep.
When we talk about dealing with somebody of the age 60 plus, 55 plus, and working with a 20-year-old athlete, what are some of the biggest differences, and what are some of the similarities between working with patients like that?
I mean, obviously, younger people, their body's going to be a little more pliable. You're going to be able to
recover quicker.
Recover quicker. You're going to be able to prescribe different things to them that you can't necessarily to the elderly population.
Sure.
You're going to have to finagle exercises and stretches for someone that might not have the strength to get up and down off the floor to perform them. So you look for stuff like seated exercises, stuff like that.
Shannon weighs in on YouTube. This is a good question. I meant to ask this earlier. With a name like Young Chiropractic, it may be a little misleading to who you guys treat.
Yeah.
But she does ask. She has a 4-year-old daughter. Do you guys treat infants and youth?
Yes. I've treated anywhere from 2-day-old children up to people in their 90s. So,
what is kind of the benefits of? And I'm assuming a lot of people, maybe if they're a premature baby or things like that, probably have a little more health concerns. But what are some of the benefits to getting a newborn child chiropractic care?
Just getting them balanced out right. So the birthing process is so hard on the spine, because when babies are born, they don't have much muscle tone.
Right.
So if it's if any type of force is required during the birthing process, forceps, vacuuming, even pulling them out, it's really gonna get that spine started down a road of misalignment, which can lead to issues down the road. That's why, take x-rays of a 3-year-old and they'll have a scoliosis. Well, how did the scoliosis get there, right?
Yeah, it's got to start somewhere.
Yeah, it gets misaligned, and then you start crawling and walking and falling down, and it's just going to be beneficial for their joint and their spine health in the long term.
We talked about the beginning process, what it looks like when you first walk in the door. You guys have 2 other phases of treatment. What do those 2 other phases look like?
So we have the very first phase is the pain relief phase, right? So our focus is getting you out of pain, right? Because we don't want to start prescribing exercises when something is out of place and in a
could make it
position to
worse.
cause you pain, right?
Yeah.
And it's going to cause you to stay there, right? Once we start to get you some pain relief, we get that subjective pain rating down. We keep it lower. Then we start shifting more towards stability. That's where we're going to start incorporating exercises, and the rehab phase begins, right?
Yeah.
And then once we get pain relief, get you stabilized, then we start shifting more towards maintenance, which is just preventative, really. Typically the treatment consists of an adjustment, and then we do some form of soft tissue work to get the muscles to calm down, right? The first step in the muscles starting to release is getting the spine corrected. And then the second phase is to kind of speed up that muscle calming down and loosening up. And we can do that through E-stim. I do dry needling, acupuncture.
Yeah.
I do cupping, Graston therapy, which is just an instrument-assisted soft tissue designed to break up scar tissue.
Are most people who go through the dry needling process open to it? I know there's the fear of needles out there. There's I've done it before. It does not hurt. I was kind of surprised. I do not like needles. Yeah. I was a little surprised. I mean, I was face down on a table, so I was a little surprised with how responsive I was to it.
I've only had 2 people ever that were so freaked out by needles.
Sure.
They couldn't handle it. I won't necessarily call it dry needling. I'll call it acupuncture right away. Because you start saying needling. I mean, it's dry needling, but you start saying needling, people get freaked out. Right. So you call it acupuncture.
That's a pro tip right there.
Yeah.
We're catching up with Dr. Derek Scholl of Young Chiropractic here on the Spotlight Omaha podcast, brought to you by Pixel Fire Marketing at Pyramid Contractors. I want to talk about growth. We kind of mentioned it. Omaha's growing at a rapid rate. You mentioned that's something you guys are discussing. What does growth over the next 3 to 5 years look like for Young Chiropractic?
Growth over the next 3 to 5 years would be to grow the current clinics, right?
Mm-hmm.
And then expand even further. So we're talking like Gretna,
Sure.
other communities, suburbs around Omaha, as Omaha continues to expand.
Is that something that you guys feel like is attainable now, or are there steps? I mean, I don't want like dollars and cents, obviously, but is that something you guys feel like maybe growing the clinics first needs to happen before that growth, or are you guys kind of waiting on the city?
I mean, I think it needs. The city's growing at a rate.
Yeah,
it can
sure.
happen now. Obviously,
Yeah.
You know, between here and Gretna, it's a 30-minute drive.
Yeah,
So,
you used to be able to get anywhere in Omaha in 15 minutes, not so much anymore.
And even between Gretna and Levista, it's still probably 20, 25 minutes. So it's something that could happen now. Obviously, you want to continue to grow the existing clinics while that expansion takes place.
Right. For you personally, you're a partner in this business. You're married. You've got personal life going on. You're talking about possibly hiring more doctors. You're talking about expansion. You're trying to build a brand. How difficult is it for you at night after you walk away from the clinic, put your phone down, put work away?
Just got to learn to juggle things.
Yeah. Right? Is it easy for you, though?
Yeah. I mean,
okay.
You got to have a very understanding wife.
Sure.
And
yeah.
You know,
it helps.
Yep. But again, if your spouse isn't included in your goals, then
probably not the right goals.
Yeah, they're probably not the right goals.
Why was entrepreneurship the right path for you personally? Obviously, you mentioned you were a previous business owner, you're a partner in this practice. Why was it your goal to be essentially your own boss and take this avenue?
It takes a lot of work, obviously.
Mm-hmm.
You know, just there's a little bit more schedule flexibility.
Yeah,
being your own boss.
Sure.
Obviously,
on paper anyway.
Yeah. It's a little tougher when you're first starting out.
Yeah,
your nose of the grindstone. You know, when Dr. Young started in November of 2007, he was working 70 hours a week and didn't take a vacation for 9 years.
Yeah.
Because, especially
I know how that feels.
especially in the healthcare field, you're so afraid to
not be there.
Yeah, not be there. And there's so many times that I would be on vacation and you would get a call or text or Facebook message asking if you were around because they were in pain, and you honestly feel bad.
Yeah, because it's what your job is, and if you're in Cancun, it's a little difficult to do that. It's not like you can jump on a Zoom call and fix that.
But you just gotta, you gotta also make it a priority to carve out that time for family.
Sure. Because your personal health is obviously important as well. If somebody is looking to get into the chiropractic field, what's the one piece of advice you'd give to them?
The field itself or in the business?
The field itself. That's the next question. Spoiler alert.
Yeah, you got to be real passionate about it.
Sure.
Because if you're not passionate about it, it
won't work.
They'll weed you out in school pretty quickly.
Yeah. And can you shed a little light on the why or how?
So first trimester in chiropractic school, we had about 3 or 4 weeks in, we had what I affectionately refer to as Hell Week.
Yeah, there it is.
And we had 8 tests in a 4-day span.
Is it surprising that is happening in this field, or does it make sense?
It makes sense.
Yeah, I would assume like putting DR in front of somebody's name, it's probably taken pretty seriously. As far as business goes, maybe not chiropractic, but just being an entrepreneur and getting into business for the first time, being your own boss, what piece of advice would you give to that person?
A lot of it goes back to staff, right? You got to have that like-minded staff, all focused on the same goal. Keep the overhead low.
Sure.
Right? That's essential in anything. Especially as commercial rent continues to skyrocket.
Right.
You can adjust your pricing to match that, and if you do,
you're gonna sink. Yeah. Any embarrassing stories about Holly Taylor that you would like to share?
Not on camera.
Okay. I've known her since 3rd grade, so I've got a couple as well. Hey, we're kind of hitting that time of day where we tend to shut her down. Is there anything about Young Chiropractic we haven't shared that people should know about?
I would just, swing by and check us out, even for a tour of the clinic. All 4 doctors at both locations were very well versed in how to treat patients, and we treat, and like I said, we treat everybody. We treated high-end athletes, MMA athletes, senior
Olympians,
Olympians, treat toddlers, babies,
future Olympians.
Yeah, and what I'll say is, I have a master's degree basically in sports medicine.
Mm-hmm.
I'm one of 8 chiropractors in Omaha that have that. So I have secondary education in prevention, maintenance of injuries, right? But athletes aren't the only one spraining ankles or spraining knees or
slipping on ice,
rotator cuffs. So we work with everybody, and I treat everyone like an athlete because at some point in our lives we're going to be or we were.
Sure. 249 5-star reviews. One location out in Bennington. That's where you can find Dr. Derek at, or you can stop by Portal Road in La Vista. Check out Young Chiropractic. You can also give them a call at 402-339-2283 if you're looking for new chiropractic care or rehabilitation. Dr. Derek, I appreciate you doing this with me.
Thank you, sir.
We'll be back tomorrow at 11 a.m. here on the Spotlight Omaha podcast, brought to you by Pixel Fire Marketing. We're going to be catching up with another unique business in the Omaha area. It's actually in Springfield, and they're doing a couple new things to freshen up your home. Hopefully you can join us tomorrow at 11 a.m. on the Spotlight Omaha podcast, brought to you by Pixel Fire Marketing and Pyramid Contractors. We'll see you tomorrow.